Hello and namaste, guys. I am Dr. Anushruti and I am back with yet another blockbuster episode. You know how actively I speak about physical therapy. So, why not to have someone who is a very well known personality in the field of physical therapy? Yes, today, as a speaker, I have the chairperson of International Affairs of Indian Association of Physiotherapists, Dr. Ali Irani. He is also the Vice President of the Bombay District Sports Medicine Association and the Bombay Suburban Amateur Athletic Association. He is the head of the Department of Physiotherapy and Sports Medicine of Nanavati Max Hospital, Mumbai. He was the physiotherapist for Indian cricket team from 1987 to 1997. He has extensive experience working with professional athletes at state and national level. He has also helped several famous Bollywood celebrities recover from serious injuries. He believes in care from warm to top. Well, all my words will fall short for his introduction. So let's directly talk to him. Hello, Dr. Ali. How are you?
Hi, good evening, everybody who is listening. And thanks a lot. Thanks for inviting. And Anushruti, the way you have been following, guiding, telling me when, everything in order, reminding. Nice of you. And love to hear that you have so much of passion for your profession. So, one of the things that I wanted to say yes or no was trying to find out who you are as only line that showed me that you are a final year student and still so much for the profession. I said, yeah, I should be talking on your program. Here I am. You ask and I shall answer.
Thank you so much. All your words, are so inspirational in all the senses. And so this coming out from you, directly from you, is, like a really golden opportunity for me to speak to you. Well, starting with the very first question, Doc. Physiotherapy has evolved a lot in the last years. I mean, I'm sure all of us, the listeners, viewers, know how much physical therapy has actually evolved in the past years. Its way of working, functionality has increased from time to time. How much do you feel is physiotherapy involved in brain mapping? Human can lie from mouth, but not from brain. So, what do you think is the role of physical therapy in brain mapping?
So, just a brief history. The first department of physiotherapy came into India in 1952 at KEM Hospital, GS Medical College, Parel, Mumbai. And the first college came in 1953 with a 2 years diploma course. And there were no takers. They had to advertise and re-advertise for somebody to come and take the 10 seats, 2 years course. From that, we have evolved to a degree, diploma became degree. And then finally, when I was a student, there were only 7 physiotherapy colleges in India, which first was Mumbai, then Vellore, Chennai, Delhi. Then there was one in Nagpur, Calcutta, Baroda. Baroda was the first degree college, started by WHO in MS University. And I happen to be from that university, MS University, Baroda. So from that degree course, and then people asking for post graduation. And when I entered in 1987, I said I was there were only 7 colleges. 87, I entered Indian cricket team. So things went well for us, and we proved our position. Every sports require a physiotherapist to be attached with them, and maybe that made today we are with 300 physiotherapy colleges, almost 100 of them giving post graduation, and more than 25 universities giving PhD program in physiotherapy. So as I was with the Indian cricket team for 10 years and then off and on with football team for Air India, made me think how a sportsman thinks, or what makes them happy, what makes them sad, and a lot of stretching that's were required. So I've done a lot of changes in the stretches. Any of my workshop or lectures, if you see, I use marble. I keep marble under the feet of a sportsman, and I can increase their touching their toes or increase their SLR. just stimulating that fascia, particular fascia, which I used to earlier do it with the back of a pen. I used to pressurize that point. But then I said, if a person can stand on a marble, nothing like it. So you are sitting in a team, there are 15 players. So all 15 could stand on the marble together for 2 minutes. And that also has to keep them busy, talk to them or make them do upper extremity stretching when they are standing on the marble. Then came, there were different things that I thought, but you came to the topic of brain mapping. That's my last thing that very regularly everybody in India wants me to talk on that topic. My studies almost now, we have finished 8 years, the ninth year of studies. Many of my master program students, especially those who are doing sports, they take brain mapping as their in the thesis because a tongue can lie, but a brain cannot. So if I'm holding your Aadhaar card and I ask you your name, you won't be able to lie me because I have a proof in front of me. So
Absolutely.
if you tell the truth, there is a frequency that your brain has worked. And if you tell a lie, that frequency changes. So that's how we find out whether a person is telling the truth or a lie. What we found out, my study was not for finding a person telling truth or lie. My whole idea was to find out at what zone. Brain has got 5 zones. We have delta zone, theta zone, alpha zone, beta zone, and gamma zone. So we found out that whenever the player had performed very well, if he was asked to imagine that and through brain mapping through a portable EEG machine, we found out that that sportsman was in alpha zone. And whenever they have not performed well, they were in gamma or beta zone. So we came out of sports and I did it randomly on college going students, just with 2 questions, asking them, you are enjoying with your friends. They were in alpha zone. And I spoke about exam. Your exam is tomorrow. The straight went to beta or gamma zone. So stress, anxiety is beta or gamma zone. Happiness, success is alpha zone. So now our study is taking us further to find out how can we get every human being in an alpha zone. There are different methods. So the topic is not only on brain mapping. So whenever I'm doing a workshop only on brain mapping, we open up at everything. How does the brain functions? So
Yeah.
this came and we are doing it on a sportsman. I try to tell them regularly how to get themselves into alpha zone. The training is that skill. The coach will give them the skill. So I say that physiotherapists no more give ultrasound and diathermy to a sportsman, but we have entered their brain. We can work on the brain.
That is what the absolute beauty of physical therapy. Well, doctor or not a doctor, I know this is a matter of debate, from the past few years. I'm sure, doctor, you would have come across these lines that physiotherapists cannot use the term doctor. And, the one segment says that physical therapists are not supposed to use the prefix doctor, while there are the segments who evidently use the prefix doctor. So, what do you think? Like, why is this situation actually happening? In the first place, why did it never happen with the doctors of MBBS, homeopathy, BDS? Why is this situation prevailing for physical therapist doctors?
Okay. My There are 2, 3 reasons I'll give. The first reason, your parents have got name.
Yeah.
Do you call them by the name? Why you call them
No,
mom, dad? Why? They have a name. Why you don't call them by the name?
no,
Because that's a respect.
yeah,
So the word term doctor in India is respect. So now let's go to the meaning of it. Oxford meaning says anybody who has done PhD can write. Anybody who is a teacher is a doctor. So let us pick up mark sheets of MBBS student. Go and pick up a mark sheet from MS or MD student. Just see what does the university write before the name. You must not be knowing about it. It
yeah,
is Mr., Miss, Mr., Miss, or Mrs.
yes,
Any university student. Let them be
yes,
MBBS, MS, MD, dental, let them be a homeopath, Ayurveda, Unani, whatever. The name cannot have doctor before. The university only writes doctor if you have completed your PhD. Your PhD degree will have a name, a title doctor before it. So what happens then? A person has done MBBS. What is MBBS? Bachelor in Medicine and Bachelor in Surgery.
Yes,
And we do
absolutely.
Bachelor in Physiotherapy. They do
Hmm.
Bachelor in Dentistry. So the word bachelor is common in all.
Yeah.
But when they go to their council, when they go to their IMA, Indian Medical Association, so then that license to practice is given as doctor. Please understand this meaning.
Yes.
University wise, nobody gets. And a topmost doctor, MSMD from India, working for 20 years, decides to go to US and practice. Once he goes there, his word doctor becomes Mr. because he is not allowed. So the policy depends on the country. Policy depends what you are looking at. I give you the first example. All our parents have name. Why we call them? By respecting them, mama, dada, ai, father, dad. Why? Because we want to respect them. So patient has to respect you. You don't shout at the patient, call me doctor. But when you are treating anybody, there's another meaning of it. Anybody who treats is a doctor. But again, go in the depth of the meaning, nobody is allowed unless you are in teaching or unless you have done a PhD. So it's a matter of argument. But when this comes legal to legality, which where we have to sit, then two, the short-minded in small cities and small towns, they fear that person physiotherapist calling himself or herself doctor is taking away my patient. So, but the top surgeons of Bombay, top doctors of Bombay, they don't mind because they have their own patients. So, is by calling it after 35 years, getting two PhD and having doctor in physiotherapy, no patient has asked me my degree. Why no
Yeah.
patient has asked me which university I have studied? They won't ask you also. Patient is not bothered to ask which college you went, which university
He is
you went, what
bothered
was
to
your
get
percentage.
the specific treatment. He wants to be well treated.
So after some time, it's the skill. What do you come out with a piece of paper?
Yeah.
Then which is lying down in your cupboard or you may frame and keep it in your clinic. But after that, patients don't ask you.
It
Patient
is the
sees your
skill that
skill.
matters.
I feel it's how a person thinks. I've not seen in big cities. I've seen most of my specialist doctors. We discuss what do you think about my patient? What should I be doing about it? Right? And I ask them, so we are not getting results. So it's a mutual understanding. And that came more because our hospital practices night duty. So we have our postgraduate students, interns, and we have a staff on night duty. So your rapport with the surgeon and doctors improve. Doctors give packages now. They want the patient to go back home early. So how fast you mobilize them, especially total knee, total hip. They want the patient to get back. So they want twice a day, four times a day physiotherapy. So you round the clock physiotherapy is given.
Hello.
We have got holiday
Hello.
duties. Are you there?
Yeah. Yeah.
Listening?
Yeah. Yeah. The
Yeah.
video got froze. Yes.
So, so we have got night duties. We have got holiday duties. So in short, for me, physiotherapy is 24/7. Do that. You raise your standard.
Totally. With this, moving ahead, Dr. Ali, I would like to ask, you hold a very, very big position and responsibility in the field of physical therapy. So, as the chairperson of IAP and having so many lifetime memberships, what do you feel are some revolutionary steps you would like to take upon for the field of physical therapy for our upcoming doctors in this?
I feel our current president, Dr. Sanjeev Jha, has taken many good steps towards our profession, almost decentralizing physiotherapy. Every state has a branch. We have five zones which have got joint secretaries. We have North Zone, South Zone, East Zone, West Zone, and Central Zone. Other than that, we have the state presidents, Maharashtra, Gujarat, North Haryana, Delhi. They all have their own president. and down the line they have their own team. And then after that, we have got every district having a branch. We have, like in Maharashtra, we have a Thana branch, Pune branch, we have Sholapur. Even the smaller city has a IAP branch. So decentralizing and reaching to every district is the new incoming thing what we have been seeing for the last 4 to 5 years. And definitely everybody knows us. And I would advise all the college principal to send the student to the rural area. Please understand, 70% of India is rural area. They also need physiotherapy. So physiotherapists at present are only concentrating at big cities.
Yes.
But believe me, more than another two third, one third are in the city, two third are in the villages. So if you go there, at least for camp, send them to evaluate people, treat the people. So people at village level should know what is physiotherapy. So tomorrow they will come directly for the treatment.
Yeah, because some of the population still don't know that most of their problems can be cured by a physical therapy session. Dr.
Um,
Ali, poor bad eating habits, which have grown so much in the past few years, especially in India. One of the habits is bending while eating. What do you feel are its bad impacts on our spine and body?
no, I feel, see, you strengthen the base. Now. If you have a good muscle power of your back and abdominal, do whatever you want. We have gymnasts, we have cricket players, we have all sportsmen players, we have people who do high jump. You see what bending they do in their spine. Why? Because they've strengthened it, they've trained it. So if we are going to live a layman, being only sitting in the office, traveling by car, and taking an elevator, and never have done exercises
Inactive
in our
lifestyle.
lifetime, and then when you want to do something, you will complain of backache. But when
Totally,
we
yes.
go into the sports fraternity, so basic warming up is there, strengthening exercise is there, flexibility is there. So we don't find in them. So let us train our population to be fit. So
Yeah.
my when I talk about fitness, the first thing comes the weight. We have derived a very simple formula: height in centimeters minus 100 should be your. Suppose if you are 165 centimeters minus 100, you should be 65 kg. Women, we prefer more minus 105 because we want them to look prettier. But men,
Yeah.
very simple, minus 100. So are you, I feel half of India won't fall in that category. All of them will be overweight. So because there is nothing, what could define as what should be my weight? So now this is the derivation, height in centimeters minus 100. So you should know what should be your weight. Then work towards it. And if you're going to ask me what I feel, the latest thing, whatever is going on, is the intermittent fasting. Eat your dinner by 7 o'clock and don't eat anything in the till the whole night. You can only allow to drink water after 9 o'clock. Uh, you can have breakfast, but I prefer morning. If you're going to start at 9 o'clock, then morning hours till afternoon should be fruits. So whether your breakfast could become fruits, and have two good meals between 11 and 12 in the afternoon and between 6 and 7 in the evening. Magical results, magical results. And if you can have a bowl of salad, at least three vegetables, raw vegetables, whatever you can take, tomato, cucumber, or carrot, or broccoli, whatever you get, the leaves, green leaves, whatever. If you can have a bowl of it before lunch and before dinner, unbelievable results. Just do it for 2 months. Usually people leave after 1 month everything. So I feel the body takes time to get adopted. The first 1 month body resists. Then next 10 days, 15 days starts compromising. Real result will come after 40 days, right?
Yeah.
So, or I would say, put it like that, the real result will come after 6 weeks. By that time, you have left that thing. You're saying, it doesn't work on me. So please, anything that you do the diet, do it for at least 2 months. Allow that 2 or 3 weeks result to be given to you by whatever you are following.
Well, doctor, we do have a lot of aspiring physical therapists right there in the audience who are listening and watching this video on various platforms right now. This time is quite difficult for them because they have this thought process that this is a, a never ending process and this is so difficult, the most hard thing they have opted for. So what is Dr. Ali Irani's message to them as a piece of motivation for them that is going to work for them in the near future?
I would only ask the young physiotherapists that we are not 9 to 5 workers. So don't expect why salary is low, why they're not. You are consultant. You raise and you demand, prove yourself and ask the patient, you want me? This is my price when I come to treat you. I would not like to name, but I very well remember when I was young and home visit charges were 60 rupees.
Mm.
And yes, in Mumbai, we had a lady who used to go and evaluate any neuro condition charging 3,000 rupees. 63,000. So maybe
That is
that what
like,
I that but it was not. So if she was saying I'm on a salary base, what could be her salary? What could be my salary? Right? I've taken salaries of 600 rupees also per month. That was my least. But when I proved myself, yes, I was charging more than a lakh of rupees per 1 day match that I used to go with the team. So you raise your standard. You should be good enough. You go to a tailor, they may even stitch a shirt for you for 100 rupees. Right? And you
yeah,
go to a tailor, they ask you 5,000 rupees. Where you say my material is 1,000, but for me, stitching is for 5,000. So are you going to say, hey, this is your salary, you should do it in 50
mm,
rupees, 100 rupees? You go to a hairdresser, the charges are different. Are you saying that, okay, what it should be? It's a name brand, it's a brand name you want to go. Most of the dresses that you buy, if you buy a branded one, you're paying 10 times more. But maybe you'll get it on a street, something very close to it, similar to it, at 1/10 of the price. So maybe you're paying for the mall, the AC that is working in the mall, he has to also get back his money. Right? So same thing is in our profession. What skill they want? How many patients can you see in a day? We all have a limitation. 10 patient, 15 patient. So then charge accordingly what you want. So you raise
so
your standard. Let people know and come to you. We want you. What is your charges? We shall pay your charges. They talk to you like this now. If you take, and people want to take me all over the country. I go to Dubai. There are people, the most of the royal families. I see they call you when I go to Dubai. They want, we'll pay you the airfare, we give you business class, come and stay with us, we'll put you in a hotel. Right? But this was not happening 30 years back. Getting it? So you
agreed.
prove so each one, and please understand, so many super specialties have come. Now, when we talk about you are specializing, suppose in sports, is one of it. Sports comes under musculoskeletal system or orthopedic, whatever you are talking. Then somebody wants to specialize only in joint replacement to give rehabilitation after joint replacement. We have physiotherapists who are only doing after ACL repair. All the arthroscopists of Bombay, they need their own physio to train because they have a protocol to be followed. So you cannot be a champion of all. You have to decide, I'll be super specialist, maybe in chest PT, maybe only seeing giving rehab to a hemiplegia. So why don't we super specialize? Tomorrow, maybe every school will require a physiotherapist. So to increase the vital capacity, I'll come back on that word vital capacity because pandemic was a blessing in disguise for physiotherapists. So more than 3,000 patients treated in our Nanavati Max, we saw that everybody's vital capacity was less than 2 liters. Do you know a lung can take 4.5 liters of air? So should I blame the government? Why people in India have 1.5 liters? They're not breathing. But if a government
Yeah.
puts a tax on it, you have to pay 500 rupees every month because you're breathing in India, then we are Indians. We'll start, we'll take deep air, paisa vasool
Yeah.
karega. Government is charging us for the breathing, right? So are we need so many physiotherapists. One simple example I'll give you. Population of Japan is 70 million, 70. You know how many physiotherapists they have?
No,
1,22,000.
1,22,000.
Now coming to you, we have 1,350 million people. and we have 60,000 members, more than half not active, because the girls feel they should marry, so they should be at home. I've seen 5 years they are with the profession, then they go back, start taking care of the children and husband. That's what is happening. So what should we be having? So even if we are going to be a million, 10 lakhs, 15 lakhs physiotherapists, it's less for the country. Look at Japan, just 72 million and 1 lakh 22,000 physiotherapists. And we are 130, 1,350 million. And believe me, our active member will be anywhere between 20 to 25,000 physiotherapists
Yeah,
in India. We have 7, 8,000 in USA. We have more than 1,000 in Europe. We have around more than 1,000 in Australia and New Zealand. So we produce physiotherapists, maybe 3,000 every year. But 2,000 go away. Very few
easily.
remain. Nobody go to rural area. I think. Next
Yeah.
question.
Well, I believe, Doctor, all these questions could have been answered only by a personality like you. All these questions of utmost responsibility can be answered with a person by a person who actually believes in this utmost responsibility of serving people in the field of physical therapy. I really appreciate Dr. Ali Irani ji for taking out time for speaking to us, and I believe you had enjoyed speaking to my audience.
Thank you. I'm sure many more questions will come to you, and I look forward that after some days again we will meet with more of your questions. But my salute to you. Keep going the same way, being a student, the interest you are showing about the profession. And I can only say, line all my viewers and of course you, may God give you all a healing hand. You all should
Hmm.
have a healing. Thank you. Good night.
Thank you so much. And all my dear listeners and viewers, this is your reminder to straighten your back. Take care. We'll meet really soon. Take care. Goodbye.